Just going to have everybody give about a 5-minute presentation of what they think is important with Medicare and what they think is important with health care in this country, statewide, federal-wide.
Now we'll have Roberta Palmer, and what do you bring to the whole issue of health care reform?
Well, thank you. It's a pleasure to be here. My background is as a provider in the healthcare system. I was an anesthesiologist, and I worked in the socialized medicine model that most Americans are familiar with, and that's the Veterans Administration. But right now I'm working with the Multnomah County Democrats Healthcare Working Group, and as you know, we have less than 2 months until a very important election, which is the most immediate hope of changing the situation in Oregon healthcare, is to change the state legislature. Because Oregon is known as a blue state, actually the legislature has been controlled by the right wing, or at least the Republicans, for about 30 years. So we must have a change in the State House. Karen Menace, the Speaker of the House, has blocked a long list of great health care proposals, and without her there, we would have a lot more progress in a lot of areas. Children's health care and expansion to the prescription drugs, which had to go through the initiative process because there was no action in the legislature. Rural health, transparency in both the insurance industry and hospital costs, just on. And she simply has to go because the only important healthcare bill that came out of the last session, or the big one I should say, was the Mental Health Parity Act, which placed mental health on the same level as physical health as far as insurance companies go. So I happen also to be a precinct committee person. I will be going door to door, signing folks up, registering to vote. I also belong to the Archimedes movement, founded by Governor Kitzhaber, and that depends, the success of his movement depends on the legislature changing its character. We have to get progressives in the State House or we go nowhere. Like we allow the Oregon Health Plan to nearly die on us because of a lack of funding and actually not even funding to the level that we can get federal matching funds. You know, how many Americans realize that there's over $1 billion in federal money that Oregon does not have access to because of this state legislature? So that has to change. We need all of our families, our friends to register to vote.